prescription drugs used to treat severe and chronic pain that are derived from a plant known as the opium poppy, which has been referenced all the way back to 3400 BC. During the 1990s, what is known as the opioid epidemic began due to doctors writing more prescriptions for opioids to alleviate not only severe pain, but mild to moderate pain as well. When it became easier to get prescriptions for the drug, the abuse of it started to become more and more detrimental to society, according to Romans 2018. The increased abuse of the drug resulted in excessive amounts of fatal overdoses and addiction to the drug, which spread fiercely and rapidly throughout society. Due to this epidemic, pharmaceutical companies made a major profit. Some have even called this current epidemic the worst in the history of the United States, with an estimated 92 million American adults reporting the use of prescription opioids in 2015 alone. Approximately 2.4 million people have an opioid use disorder, either due to prescription opioid use or heroin use in the United States. From 1999 to 2015, the number of deaths due to opioid-involved overdose has quadrupled. Estimates suggest that 91 people die each day in the United States from an opioid overdose, and approximately 1,000 people are treated in emergency departments daily due to opioid use, according to Stewart, published in 2018. The increase in opiate-related substance abuse resulted in a rise in the production of a drug known as naloxone, which is used in reversing the effects of an overdose. According to an article on publicmed.gov, to combat this mortality trend, naloxone is increasingly being utilized in a pre-hospital setting by emergency personnel and prescribed to laypersons for out-of-hospital administration. Naloxone, also known as Narcan, is a drug that can be given nasally or intravenously that blocks opiate receptors in the nervous system and reverses the effects of an overdose. Subsequently, having naloxone more readily available has reduced the mortality rate of opiate-related overdose. Although naloxone has saved many lives, it is a very costly drug which is beneficial to pharmaceutical companies, but like I said, it is detrimental to emergency services, medical facilities, and municipalities due to the high price of the drug and the increase in the amount of the product needed in stock for patients. Furthermore, due to the increase in demand of Narcan, according to an article in the Washington Post, the strain on municipal budgets and a need for an increasing amount of naloxone has made it difficult to keep enough in stock, according to Zima 2018. Not only has the abuse of opiates resulted in an increase of the need for naloxone, it has also become a result of the increase in the need for methadone and Suboxone to treat opiate-related withdrawal symptoms. These two drugs are used to alleviate withdrawal symptoms that come along with the body's mental and physical dependency that comes along with opiate addiction. Unfortunately, in some cases, not only does opioid addiction affect the addict, but it also causes severe withdrawal symptoms in newborns of women who abuse the drug. According to the Substance Abuse and Mental Health Services Administration, the number of babies born addicted to opiates each year ranges from 100,000 to 375,000, which results on average of one baby being born addicted to opiates every 15 minutes in the United States alone. In conclusion, Thomas Christensen stated in his article called The American Opioid Epidemic, Facts, Stats, and How You Can Help, that legal and illicit opioid use impacts people from all walks of life, including young adults, entire families, and even unborn children. That being said, since the abuse of opiates has become a worldwide problem, medical professionals have taken steps to reduce prescribing opiates to patients unless they are absolutely necessary to treat painful conditions, as well as taking preventative measures regarding overdose by making naloxone more readily available to the public.